This is chapter 14, medical terminology, the endocrine chapter. Okay, for the endocrine system is actually talking about glands. It is a messenger system, but unlike the nervous system, it's a chemical messenger system in the form of hormones that enter the bloodstream. There are 7 main glands in our endocrine system that maintain homeostasis. We have the pituitary gland, thyroid, parathyroid. And remember, you do not need to know the anatomy or specifics about where things are located. This is just to give you a frame of reference, and you can go back and kind of understand. Like we wanted you to see photos and diagrams so you understand that the parathyroid gland those 4 glands are located on the thyroid gland. Adrenal glands, pancreas. The pancreas can be considered endocrine or exocrine. Pineal gland, thymus, not to be confused with thyroid. Thymus is different than thyroid. Thymus is located in the center of the chest. It is huge in infants and gets smaller as we get older and has to do with the immune system, whereas thyroid has to do with metabolism. Okay, as far as your term lists, acro means extremity. So megaly we know means enlargement, acro meaning extremity. So in this case, his extremities are enlarged. Adeno. You may want to star in your notes to be careful of the 2 differences between adeno and adreno. They are all but the same except for the letter R. So adeno has to do with gland, adreno has to do with the adrenal glands specifically. So this could be any gland. So if you have adenopathy, you have a diseased gland. And here's the other. Adreno, like you can see, is very similar to adeno. Adrenalo, same thing, meaning adrenal glands. So adrenalectomy, removal. Adrenomegaly is enlargement. Calco. There are some things that elements that you might need to know for this chapter. You want to maybe star calco and cali, which we'll learn in a second, because they sound similar and people get them confused. Calco stands for or is the word root for calcium. And we'll see a lot of emia, meaning in the blood. So calcium in the blood, nitrogen in the blood, potassium in the blood is emia. And hyper meaning too much or excessive, hypo meaning too low. So crino or crin has to do with secrete. So I mentioned before that the pancreas is an endocrine gland and an exocrine gland. Endo meaning inside, the prefix inside, exo meaning outside. So endo means that it secretes inside through ducts into the bloodstream. Your exocrine glands are typically that secrete to the outside. The most common ones are sweat glands, but crino means secrete. Okay, we have 3 for sugar or sweetness, glyco, gluco, or glycoso. So in the example of glycogenesis, that means the formation, the beginning, the origin of sugar. So making sugar. Gluco, like glucagon, also means sugar. Glycosuria, you haven't had that suffix yet, but it means urine. That means sugar in the urine. Now, of course, you wouldn't, on a test, you wouldn't necessarily know which sugar it is. So any of these threes would count for your exam. Okay, this is the one I wanted you to star next to calco because calco and Cali are similar. If you remember the periodic table from chemistry, potassium, the symbol is a K. So if you can remember it that way, potassium is a K. And here we have that hyperkalemia and hypokalemia, meaning in the blood, either hypo or hyper. Okay, sodium on the periodic table is Na. So natro is the word root for sodium. And hyponatremia would be, we would break that down to be blood condition of low sodium. Pancreato for pancreas. That one works out nicely, easy. You can recognize that. But be careful here. If you don't know your suffixes, this will trick you up. So pancreatotomy is an incision or to cut. A pancreatectomy is ectomy, meaning removal, or excision, removing the pancreas. And a pancreatocele is a hernia or swelling of the pancreas. Your parathyroid glands, I mentioned those before. There are 4 of them. They have to do with calcium in the blood, and they sit on the thyroid gland. The thyroid gland looks sort of like a butterfly. So parathyroidectomy, removal. Parathyroidomegaly is enlargement. Thymus. I mentioned you might want to star thymus and thyroido because they can be confused. Remember, the thymus is a gland in the center of the chest, has to do with the immune system. Thymoma is a tumor on that thymus gland. Thymectomy would be removal. Thymotomy would be incision. Thyro and thyroido are the word root for thyroid gland. So thyromegaly, enlargement. Hyperthyroidism is a condition of excessive thyroid hormone. And thyroma is a tumor of the thyroid. Toxico, if something's toxic, it's poisonous. Toxico means poison. So be careful here of toxicologist and toxicology. One is the person, one is the study of. The ist is the person that specializes in it. The ology is the study. Okay, suffixes and prefixes for this chapter. Crine, just like crino, could be a word root. Crine is a suffix. For example, endocrine means to secrete within. Dipsia. Dipsia has to do with thirst. Poly meaning many or much thirst. So if someone is super thirsty, they have polydipsia. Just a side note, diabetes is often first discovered because of the 3 polys. Polydipsia, polyphagia, which means excessive eating or many or much eating, and polyuria, which means many or much urinating. So if someone is constantly eating, constantly drinking, and constantly urinating, those are the 3 polys that may indicate diabetes. Toxic can be a suffix. So in this case, thyroid toxic means that it's poisonous to the thyroid gland. EU means normal. So if somebody is euthyroid, they have normal thyroid levels. Exo I mentioned before means outside. Like an exoskeleton is something insects have, and it's not like bones on the inside, it's like an outer skeleton. Okay, some abbreviations. K is potassium, and remember that's Kali, not calco. Kali in a word root. Na is sodium. SX. So SX is symptoms. If we're referring to signs and symptoms, it would be S and SX. But SX alone refers to symptoms. RX is prescription. Here is your S and SX. That's your signs and symptoms. And remember, signs are objective, symptoms are subjective. TX, treatment. So RX is prescription, TX is treatment. N/V, nausea and vomiting. You can have not just nausea, no vomiting, the N without the V, but usually we'll see it like this, nausea and vomiting. Diuresis is similar to polyuria. It's increased formation or secretion of urine. So if someone takes a diuretic medication, they're going to have to frequently go to the bathroom. Okay, and there's some let's practice, and I'll let you go ahead and try that on your own.